Senate Bill 184 provides relative to abortion to prohibit the abortion of an unborn human being with a detectable to prohibit the abortion of an unborn human being with a detectable heartbeat, to provide definitions, to provide penalties, to provide for effectiveness, and to provide for related matters. Thank you.
Senator Milkovich on your bill.
Thank you, Mr. Acting Chairman, members. We believe that children are a gift from God, and Senate Bill 184 is squarely predicated upon science and Louisiana law. Dr. Jerome Lejeune was a late French physician and genetics researcher who in 1959 in his own Paris laboratory found a third small mark on the 21st chromosome known as trisomy 21. He basically made the foundational breakthrough in discovering the genetic indicator of Down syndrome. He then went on, in the face of a scientific and industrial effort to use that as a predicate for killing babies in the womb, had a very profound spiritual, psychological, and existential development in his life where he came, Representative Moore, to become an outstanding international advocate for life. And I believe it was in 1991, Dr. Lejeune, again, in his day noted as perhaps the most preeminent geneticist in the world, testified in this building, working with Representative Woody Jenkins, Mr. Acting Chair, and helped pass one of the strongest pro-life bills in America at that time. Was subsequently vetoed by the then governor. But this is what Dr. Lejeune teaches us, and this is based upon really valid and undisputed science, and that is when the 23 chromosomes of the father unite with the 23 chromosomes of the mother, there is a zygote or a single cell formed that is, Dr. Lejeune says, the most complex cell in our known universe. And that is you. That is the acting chairman. That is House Assistant Murray. That is Representative McMahon. Every genetic indication and blueprint and structural diagram of who we are is in that cell. Obviously, the point of Dr. Lejeune was that the person exists in that cell. There is life from the point of conception. That is a scientific fact. The medical literature, the medical industry, medical science has now come forward over the last several decades and confirmed that the fertilization, when that occurs, there is a new human being that comes into place when that single cell is formed, that zygote. When human life begins, according to the American College of Pediatricians in March 2004, that is when that moment of conception, the uniting of the two chromosomes. Very quickly, I need to move on so that y'all can ask your questions, but I will state this, that our United States Constitution does not provide a right of parents or the state to kill children. There's nothing in the Constitution which states that our 50 states do not have the right to protect the unborn, and there's nothing in the Constitution which says that these unborn children do not have a right to live. We know scientifically that life begins at the fertilization at the moment of conception. In Louisiana law, a number of statutes in Louisiana state that life begins at the moment of conception. And of course, we know what Scripture tells us. I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works. My substance was not hid from thee when I was made in secretly and curiously wrought in the lowest parts of the earth. Your eyes, Lord, did see my substance, yet being imperfect. And in thy book all my members were written, which in continuance were fashioned, when as yet there was none of them. We are a being upon conception, scientifically, legally, scripturally, and we're concerned today is that we can come to devalue life, and we believe that that has happened in America's history in our mistreatment of slaves. We believe that that has happened at times in our treatment of the American Indian. We believe that can happen in the mistreatment of prisoners. whenever we get to the point where we devalue human life, it becomes easy for us to justify. And we say the same thing, members, about unborn babies. They are life, and we should understand the totality and humanity of who they are and not dehumanize them so that we can justify disposing of them. And I will close by saying that to the extent this bill has merit, we want to acknowledge the other states that have gone before us. Mississippi, Georgia, Kentucky, Iowa, North Dakota, and Ohio, states from across the nation are saying that we're no longer going to devalue life. We're going to acknowledge the sanctity of human life. And I will state in closing that before I yield to questions, if there are any, that obviously my position as a citizen and as a legislator, I'm against all abortion from the moment of conception. We do think this is an important blow against the abortion industry and in defense of the unborn, to say that, which the bill says, once a fetal heartbeat is detected, the baby cannot be killed. And with that, Mr. Acting Chairman, I'll certainly yield to questions if there are any.
There are no questions at this time. We have several people here in support and would like to speak. We have Ben Clapper with Louisiana Right to Life. You can come up now. Mike Bourgeois and Gideon Roseman would all like to speak and present in support. Jennifer McCoy. Not here. All right, you can state your name. You can come up now and speak with him.
Chair and members, my name is Ben Clapper. I'm director of Louisiana Right to Life, state's pro-life organization that was founded in 1970 to restore the right to life in Louisiana from conception through natural death. We come in support of this bill. One of the most fundamental indications of a human life is the heartbeat. And this bill means to protect that unborn child when the heartbeat is detectable. Of course, the heartbeat begins beating closer to around 18, 22 days after conception. This legislation that Senator Milkovich has drafted and brought forward is to protect the unborn child when the fetal heartbeat is detectable through standard medical means. We support this bill. We also support the amendment that was put on in the Senate committee to make it effective upon the outcome of a Mississippi court case on a very similar law. What this amendment enables the state to do is to have the law be enforceable when Mississippi's law finishes its court process. So that allows our Attorney General to remain focused on the 5 cases it's currently defending on other pro-life legislation that has passed through this room, your committee, over the past 3 to 4 years. So this doesn't, slow in any way the enforcement of this, because, of course, if this were to be passed and we did not make it hinging on the Mississippi case, then we would be looking at a court case here in Louisiana. So we ask your favorable passage of this legislation. Thank you, members.
Mr. Ben, there's no questions. You said you represent Louisiana Right to Life?
Yes, sir.
From conception to natural death?
That's right.
I just had a quick question. Did y'all take a position yet on the death penalty?
Chairman, we do not take a position as an organization on the death penalty. I personally am opposed to the death penalty and support that legislation, but our organization, since it was founded in 1970, doesn't take a position on it. We try to keep our issues as narrowly tailored as possible, and so that's an issue that we've remained neutral on.
Okay, we do have a question. Representative Jackson.
Hey, Ben.
Hey.
Mr. Clapper, so along the same lines of questioning as Representative Miller, I know that traditionally I've researched Right to Life has not taken a position on that. Has it been up for discussion with the board or whoever makes the decisions for Right to Life?
Sure, it's a regular topic that we discuss, and I know that we're affiliated with National Right to Life as a national organization which has 50 state affiliates, and each member of those sits on a board of National Right to Life, which partly makes those decisions in association with us. So it's a big undertaking to change or add positions. We have consistently remained neutral on issues such as contraception, for example.
Right.
And then, for example, even on issues such as war or other things, we've remained neutral on those issues and tried to keep it tailored. We certainly understand that the at capital punishment can unintentionally result in the conviction of an innocent person, but we remain our difference remains focused on the fact that the unborn child and those who else that we take positions on have their innocence is pure, and so there's no discussion on the matter of whether the state has the authority to do that or not. So we believe there's a qualitative difference on the issue. Now, I certainly understand the similarities in there, and that's why I take a position personally. But our organization has to, remain focused on its issues as best as possible as an organization.
And I understand, and I'm against the death penalty as well personally. My concern has become, in the state of Louisiana, we've seen so many convictions overturned over the last 10 or 15 years. It just seems that we cannot, with certainty in our court system, say who should be put to death or not. And I always say when I'm advocating for life that if I can save one innocent life, then what I do for life is worth it. And I'm kind of getting that way with this death penalty issue as well, as I see those who have been wrongfully incarcerated coming out of jail. And so I would request at some point to discuss with Louisiana Right to Life, since we seem to have one of the highest turnover rates of wrongful convictions, what the procedure would be to request that we look at that issue.
Sure. Well, I would certainly welcome that conversation, Representative Jackson.
Thank you.
Ben, you also mentioned, once again, you said from conception to natural death.
Yes, sir.
But you said the right to life is remaining neutral.
Sure.
Do you think it's fair for them to remain neutral if the mission is from conception to natural death?
Sure. So our mission is, and again, it does kind of pivot on this technicality that we're talking about, that the mission of our organization is to restore the right to life, and it focuses on innocent human life in the situation. Now, I understand, as Representative Jackson mentioned, that there are times when there are innocent people convicted, and that is very unfortunate, and certainly, as I mentioned, is one of the many reasons that I myself would oppose and support the moratorium on the death penalty. As an organization, we do understand over time there has been the authority that the state and many faith traditions as well have recognized that in certain situations there is a potential legitimate authority for the state to make that decision based on correct convictions in those situations. And because of that, it becomes a separate issue, of a qualitatively different issue because of that situation, because the role of the state and how they handle that situation. The unborn human life, the unborn child, of course, has no choice in the matter at all, right? Their life is, of course, they didn't decide that their life wanted to be terminated, and they didn't want to be killed early on in the situation. The same goes with euthanasia and other questions like that, or even things such as embryonic stem cell research, when the human embryo is destroyed, of course, with no choice of their own. So regardless of whether it's fair or not, it's still, we see as a qualitative difference on the issues, even though it's often, especially in this building, the same language is used back and forth. So we would still say that there's a qualitative difference on the issues, and that's why we don't take a position as an organization.
I understand. I think this committee is going to overwhelmingly support this legislation because we believe in the right to life, right?
Yes,
but we
sir.
Also, a lot of members here, you keep mentioning quality. We believe in quality life.
Absolutely.
We believe that any kid that's born should have an opportunity to have access to health care, should have an opportunity to have access to good education. We need Louisiana Right to Life to come to the table and support us when we're fighting for that unborn kid, once they're born, to have a quality life. And there's a lot of opportunities that I think we have to join to help that kid that once that kid born, whether it's disability, and we pass the TEFRA Act to where the parent's income isn't going to be a factor in that patient getting health care or not. Whether it's, like I said, access to quality living, we need Louisiana Right Life to help support the members that support these pro-life bills, because we are a pro-life state, but we have to remember, you keep using quality. It's important that we fight for a quality life for this born individual.
Absolutely. And Representative Miller and I support all that you obviously are a champion on both sides of this, right?
Well, I like you.
Well,
Listen. No, seriously.
Oh, I'm very happy about that. Thank you for that compliment. But I will say that we just supported Senator Morrell, and I don't know if it comes through this committee or not, but his diaper sales tax legislation, right, that is coming over here, not in the form of a constitutional amendment now, but in the form of a statute. We did support that. We do understand and we do support the state funds that are used in pregnancy help centers to support moms and babies before and after birth. So we do things like that. Again, we understand as an organization that, sometimes the broader you become, it becomes harder to tack your path forward in a sense as an organization. So, and there are organizations throughout this building that have to take that kind of narrow path at times. We do as an organization, we certainly always look for opportunities to support moms and children before and after birth in a way that we feel that we discern is the best for our organization and for our cause, and we'll continue to look forward to that.
Good deal. And I'm just once again encouraging your organization to join the war of making sure we don't narrow that path to that born child. But we have another question, Representative Cox.
I know at the appropriate time I want to move forward with this bill, and I don't know if anybody said that yet. That's all I have to say.
I'll put it down, Representative Cox. Now is not the time.
Thank you, Mr.
We have
Chairman.
a few more brief comments. Please identify yourself.
My name is Mike Bourgeois. I am a retired PR person. I have a degree in journalism from LSU. I was PR director for the United Way here and in New Orleans, and then I came back and became PR director for economic development in DOTD. Since I retired in 2004, I've been doing pro bono PR work for various pro-life individuals and organizations. And I just came here today to give everybody here some confidence in that you will be doing the right thing if you vote for this bill, because when Justice Harry Blackmun wrote the majority Roe v. Wade opinion that declared that those in the womb don't have any rights because they're not legal persons. They may be people, but they're not legal persons. Everybody thinks that was the precedent set for denying rights. However, the precedent of denying rights to individuals in this country was in the 1857 Dred Scott decision, when they said enslaved Africans in America have no rights because they may be people, but they're not legal persons. All right, so that whole legal person thing, the Supreme Court has never even apologized for that abomination. And they never got rid of it. What got rid of it was the Civil War, the Emancipation Proclamation, and the 14th Amendment. So when you fast forward to 1973, Roe v. Wade just re-legalized the whole abomination again. And so everything that you know about abortion is probably the only thing that you know that is not false narrative and fake news from the multi-billion-dollar abortion industry, the only industry ever single-handedly created by the Supreme Court out of thin air, is that it's legal. But you got to know the difference between a Dred Scott decision and a Roe v. Wade opinion to know if you got settled law or if you don't have settled law. The Roe v. Wade opinion was based on the Supreme Court's theory that nobody could determine when life begins, and because no two groups determine when life began, could agree on when life begins, or no two individuals, they were going to err on the side of creating this new right to privacy out of thin air. But he said, he put a caveat in there. He said, even if the suggestion of personhood is recognized, that, quotes, collapses Roe v. Wade and the right to abortion and guarantees 14th Amendment rights to all of those in the womb as same as it does to all of those outside the womb. But the pro-abortion industry does not want to recognize that because it would turn them into a buggy whip industry. And they fight it tooth and nail. And they'll come up with things like if you declare the people in the womb legal persons, it's going to criminalize birth control, artificial birth control, false narrative from which the newspapers here generate their fake news through their bias of omission, and I know because I've dealt with them my whole life. If you think of the Hobby Lobby decision, the Hobby Lobby decision said there's 20 kinds of birth control pills. But the Supreme Court said that, but they said Hobby Lobby only can withhold those 4 of them because they're abortifacient. The other 16, they have to provide them to their employees. So, did that kill artificial birth control? No, that's fake news, false narrative, and the whole thing is like that. And when you give it to the newspapers, and I have all the emails that I sent and all the hard copies, and this is the last thing I want to say. In the Advocate, a story in February of 2012, it says, the Oklahoma Senate has overwhelmingly approved an anti-abortion personhood bill that declares life begins at conception. The vote Wednesday upset doctors who fear the proposed law will jeopardize reproductive medicine, i.e. ban birth control. All right. But the major thing that I want to say there is Marcia Schuler wrote in this story in 2015 in The Advocate, legislators have introduced personhood legislation in Colorado, Mississippi, Missouri, Montana, New Hampshire, Rhode Island, South Carolina, Virginia, and Washington, but none has passed. What she failed to say was that in 1986, the Supreme Court ruled on a 1986, which was 2 years after DNA profiling proved that life begins at conception. Their Oklahoma bill was modeled after a 1986 Missouri law that was later determined by the U.S. Supreme Court to be constitutional. So what does anybody, if you can either go with the facts or go with the fake news. That's up to every legislator.
No questions? Please state your name and speak. State your name and speak.
Oh, I'm sorry. My name's Jennifer McCoy. I'm a nurse. I work with people with traumatic brain injuries. I've been a nurse about 18 years. And I wanted to testify, as I did before, to the fact that I was in the clinic in New Orleans, went there for a pregnancy test, and was told I was pregnant, then was given an ultrasound, and you have a copy of the picture of that ultrasound from the clinic, where it clearly shows that there's a baby in there. And then I went from there. I had a business trip. I had to go to Detroit. I got ill. I went to the doctor. I was given a blood test, a pregnancy test, and an ultrasound, all telling me the next day that I was not pregnant. However, the abortion clinic had said, we need to schedule for an abortion every week. It costs more, so the sooner you want to do this, the better. So They were happy to do that and to hand me prescriptions that I didn't need because I wasn't pregnant. So, to begin, I want to tie this into the heartbeat bill by saying, if they had been made to show a real-time ultrasound, it would have been a whole lot harder for them to fake the fact that I wasn't pregnant and tell me that I was. I have all the evidence to prove to you that that's what they told me, and then the evidence between my blood work, my ultrasounds, my pregnancy tests from the MER that said that I wasn't pregnant. Now, I wonder how many other girls this has happened to. How many more carry that with them that weren't even pregnant but went through the whole process of either a chemical abortion or a medical one. So I want to say that much to tie it into the fetal heartbeat. And because I did not get a chance before, I brought you some more information in case my character gets attacked again this time. First of all, I guess I wasn't in the room, but many things were said that were not true. The other side Googled my name and then came up with all these things. 23 years ago, it is true that I did plead guilty to conspiracy, and I did serve 2.5 years. Then 12 years later, the laws they used to put me into jail were overturned as unconstitutional. But I had already given up 2.5 years of my life and left 4 of my 12 children behind. So, while I was in prison, Mother Teresa helped me through my entire case. Here is a letter she sent me. I gave you guys a copy of it. FMC Carswell is Federal Medical Center Carswell. She worked with me from the beginning of my case until she died. This letter was written to me 2 months before she died. She even helped me with a girl in the prison who was pregnant and going to get an abortion to find a family and put her baby, Faith Marie, up for adoption. Wherever she is, she's 22 years old now. So if there's any questions about that, the attack on my character, that's all I can say to answer that back. But that's all they could say last time. They didn't address, they did not address what they did. They lied. They said I was pregnant. I wasn't pregnant. They scheduled me for an abortion that I didn't need. So I guess that's all.
Thank you. There are no questions at this time.
I had one last comment I need to say.
I'll just be brief.
Okay. Okay, I am. The reason I know that Marcia Schuler had this information and she wouldn't refuse to print it is that I gave it to her face-to-face at the press club. I was a member at one time. I gave it to her in email. I gave it to her in letters. I gave it to her over and over again, and she refused to print it. And I experienced the same thing in state government and at the United Way too. If it conflicts with whatever view they have, the bias of omission rules. I don't care how many Pulitzer Prizes you get for doing a liberal story, but if you've got factual data and information and the facts, and it destroys their false narrative, they're not going to do it.
Thank you, sir. Thank you for those comments. The rest of the green cards that are here in support of the bill but would not like to speak: Angie Thomas, Kathleen Lee, Christy Cross with LFF, Mary and Susie Labrie, Patricia Pearson, Patricia Kelly, Helen Kavir with Louisiana Family Forum, Daniel Green, Charlene Bliss, Richard Bliss with John Milkovich. And that's it for the green cards member. We would now let the opposition speak. President would like to speak is Amy Irvin, Michelle Ehrenberg, and Rashila Suman. Okay, just 1 second before you speak. We have Representative Jackson with personal privilege.
Good morning, members. I want to take the personal privilege. We have a lot of white coats here today, and I am impressed with all of them. Thank you so much for providing health care all throughout our state. It's very important at a time when we've expanded Medicaid and there's so many needing health care. But I want to recognize especially those from Monroe. I see a doctor in here and want to say hello, and you, and I think there's other students with you and physicians with you, and University Health is in the place. And so I want to say welcome to the Capitol. I look forward to meeting with you later, and thank you so much. A lot of people look at physicians as just a career, but I know that you provide an invaluable service and answer calls all times of the day and night, as I call my physician all day and all night. Thank you.
Well, just don't take her on as a practice if she's going to call you all day and night. But look, welcome. Welcome to the committee, members. Just state your name and speak.
Hello, my name is Amy Irvin. I'm the Executive Director of the New Orleans Abortion Fund. Thank you so much, Chairman and representatives. The New Orleans Abortion Fund provides financial assistance to women who cannot afford the full cost of abortion care. Working with local medical providers, we provide compassionate and empowering assistance to women seeking abortion and distribute pledges as available. We affirm a woman's right to control her body and her destiny and work to ensure that all people have access to quality medical care, regardless of their economic situation. Today, I'm here to testify against SB 184, an unconstitutional ban on abortion that ignores our clients' needs and circumstances. In fact, SB 184 would ban abortion before most women even know they are pregnant. It is a far-reaching bill that goes against 45 years of precedent. It prohibits abortion long before the state has the right to do so and fails to adequately protect women's health throughout pregnancy, as required by the Supreme Court. This will drag Louisiana into a costly battle at the Supreme Court, stretching our state's resources thin at a time when we could be supporting education, primary health care, and other vital services. Louisiana has already spent $1.5 million in litigating anti-choice legislation. There's no justifiable reason to spend more. National polls consistently show that 7 in 10 Americans support legal abortion. Yet politicians and national anti-choice organizations promoting these bans have made no secret of the fact that their core objective is to ban all abortion, including in cases of rape and incest, and even when a woman's health is at risk. SB 184 has no exceptions for rape or incest, a horribly cruel omission. Both Senator Milkovich and Louisiana Right to Life Executive Director Ben Clapper have gone on record saying that they oppose all exceptions. In fact, senators and State Judiciary Committee approved an amendment to allow exceptions for rape and incest until Mr. Clapper testified that the organization opposed the amendment. I asked this committee, who is this legislative body representing? The people who fund your re-election campaign or the women of this state? I'd also like to take exception with how this committee and many of the Louisiana legislators, including Senator Milkovich and his supporters, have characterized abortion providers, clinics, and supporters. Phrases such as abortionist and abortion cartel, abortion industry, to describe trained and licensed physicians and healthcare providers are derogative and inflammatory, contributing to violence towards providers and clinics alike. That a sitting senator allows a convicted felon charged with arson at 2 Virginia clinics to testify here today is dangerous and unacceptable. In 2018, the National Clinic Violence Survey, the Feminist Majority Foundation found that the percentage of clinics reporting the most severe types of anti-abortion violence and threats to severe violence remains dangerously high. Almost a quarter of the clinics surveyed in 2018 experienced one or more incidents of severe violence or threats of severe violence. Some of the most common types of severe violence and threats of severe violence include blockades of clinic entrances, stalking, facility invasions, death threats, and physical violence. One of the most disturbing findings of the survey was that 52% of the clinics reported experienced targeted threats and intimidation against doctors and staff. Stalking, harassing phone calls, harassing emails, and social media posts, and tracking of activities were among the most common types of targeted threats and intimidation that staff experienced. To ensure the safety of patients going to Women's Healthcare Center in New Orleans, the New Orleans Abortion Fund has trained more than 330 volunteers as clinic escorts who take weekly 2-hour shifts at the clinic. They have provided more than 3,000 hours of community service, and I am proud of their work. In response to anti-choice extremist Jennifer McCoy's testimony in the Senate hearing, Clinic Escort Coordinator Olivia Anderson said, "Clinic escorts protect patients from harassment on a daily basis when patients and their loved ones are simply trying to enter a clinic. These protesters mock, intimidate, and threaten not only the patients, but the staff as well, using PA systems, bullhorns, literature with medically inaccurate information, grotesque imagery, and misconstrued Bible verses that try and make themselves part of a conversation that does not concern them or their religious freedom whatsoever." Yesterday's testimony, and she was referring to Ms. McCoy's testimony in the Senate, was an extension of their inappropriate and dangerous campaign to control the bodies of Louisiana women. Louisianans need more health care, free of harassment, not political posturing. If you were truly concerned about reducing the need for abortion, you would fight for accurate sex education, equal pay, minimum wage, and common sense measures that support working families. Ironically, the same legislators that purport to support life consistently vote down equal pay and minimum wage bills that would economically help families. These abortion bans are not about protecting women's health and well-being. Instead, they are advancing a political and ideological agenda that will deny women their self-determination by eliminating their ability to plan their families. Low-income women, women of color, rural women, and women who are abused or assaulted will suffer the brunt of this ban. It will force women seeking abortion services back into dangerous, desperate situations, reviving the public health crisis that existed before Roe v. Wade. Or, sadly, have children they are not prepared to raise because we've abdicated our responsibility to provide for children and families. The decision to have an abortion is a personal medical decision made in consultation with her doctor, as well as faith leaders, family, and other people close to her, not by politicians. In a state with dismal health outcomes and high rates of maternal and infant mortality, passing such a ban in Louisiana poses a threat to women's health, their families, and their futures. 1 in 4 U.S. women will have an abortion by the time she's 45. In this room, there are women that have had abortions and have gone on to raise healthy families, finish their careers. We trust Louisianans to consider their options and obtain the care they need. So should you. Louisianans seeking abortion deserve better from their lawmakers. In this time of economic security, when our society's safety net is being decimated, placing additional barriers on health care is unnecessary and cruel. We trust Louisianans to carefully consider their options and obtain the care they need. If you vote to ban abortion before most women even know they are pregnant, you're putting political ideology over sensible public health and respect for women. As this bill moves through the Louisiana Senate, we call on you and your colleagues to trust your constituents, to trust Louisiana women. Thank you.
Thank you, members of the committee, for allowing me to testify today. My name is Michelle Ehrenberg. I'm the executive director of Lift Louisiana. We are a nonprofit organization that advocates for policies that will improve the lives and well-being of women in the state. This abortion ban would rob Louisianans of the freedom to make the most personal decision, which is whether, when, and how to become a parent. This is an intimate choice with no place for politicians. People should be able to decide what is best for themselves and their life circumstances without political interference. The objectives of SB 184 go against guidelines for high-quality, respectful, and patient-centered health care. In fact, the American College of Obstetricians and Gynecologists has recently issued a statement opposing bans like this. And 75 doctors, nurses, medical students, and public health professionals in Louisiana have signed on to a letter in opposition of this proposal, and that number continues to grow. As was previously stated, a ban on abortions at this stage in pregnancy would prevent most people from accessing abortion at all. I'm not trying to be duplicative. I just think that this is an incredibly important point for the members to consider. At 6 weeks, most people don't know they're pregnant, and many women seeking abortion face logistical obstacles like finding a provider, securing child care and transportation, getting time off of work, and finding the funds to cover all of these costs. All of these things create delays. With a ban so early in pregnancy, many will find that once they discover they're pregnant, it's already too late for them to get an abortion. Persistent disparities in healthcare access that are caused and perpetuated by structural racism and systemic inequalities in Louisiana and across this nation are already preventing women from getting necessary services. This bill puts a further burden on their reproductive health. Abortion restrictions like this disproportionately harm women of color, women in rural communities, and women with lower incomes. Black women in Louisiana have limited access to reproductive health care and prenatal care. They are 4 times more likely to die from pregnancy than white women, and this committee should be focused on protecting their lives. SB 184 will doubtlessly result in some people being unable to get appropriate care for compromised pregnancies. A ban at 6 weeks could discourage doctors from providing abortion even in emergencies, putting pregnant people at risk of injury or death. And more could experience denials of care, like that experienced by Tamisha Means, a Michigan woman who was suffering from a miscarriage and showed signs of infection, but was sent home from a religiously affiliated hospital rather than being provided with a medically necessary abortion. Indeed, in countries where abortion is banned with only limited exceptions, many women are denied care, even in cases where their health and lives are at risk. Bans on abortion this early in pregnancy have consistently been declared unconstitutional in courts across this country. This ban directly contradicts the precedent set forth by not only Roe v. Wade, but more than 45 years of Supreme Court precedent, including in 2016, the decision in Whole Women's Health. These bans prohibit abortion long before the state has the right to do so and fail to adequately protect women's health throughout pregnancy, as required by the Supreme Court. This legislature's attempt to inoculate itself from legal challenge by tying this bill to the outcome of a legal challenge in another state acknowledges that this bill would be challenged in court and likely struck down. So what are we even doing here? I will just close by saying that a person's ability to access safe and legal abortion when they need it is a critical component of health and dignity, as well as independence, freedom, and social and economic equality. And that is what the women in Louisiana deserve. Thank you.
Hello, I'm Rashali Saman, and I'm coming here from Monroe. So I kind of, thought I'd contribute my opinion here. I'm not as prepared as you ladies, definitely, but I'd like to just urge some consideration. As doctors, for the most part, from my experience, generally we don't think so much about industries and, whose agenda is what. Generally, patients come to us and, we kind of see everybody on a case-by-case basis. And for us, like the patient, their families, their children, that their health kind of matters the most. In terms of, when life begins, that's been a debate that's been going on for many years. For me, as a doctor, as a practicing resident physician currently, I see many families dealing with unwanted pregnancies, whether it's through sexual abuse or of any kind, or even from financial complications where they're not feeling ready to rear a child. So we were having this debate earlier about quality of life, and I do agree with that point where it's, what is the quality of life of a child that comes into this world where he or she's not wanted, and a family where the family is not able to give education or not able to rear that. The problem I find with laws in general is they tend to apply across the board, and there are a lot of different cases where people's situations are very individualized and not always considered. So in that case, if one person is not able to rear that child, where does the system come in to support that? I'm sure there are facilities that can give some kind of support, but not everybody understands how that works. Not everybody has access. Not everybody has education. So there's a lot of different factors that are involved in that. And, things like safe sex, education, obviously making conscious choices, these things would need to be addressed on a more regular basis with the majority of the population. And I'd also like to just, add one point is that science is a complicated thing, and so is pregnancy. Generally, a lot of women, even if they're pregnant initially, can have spontaneous abortions within the uterus. And at that point, the product of conception puts the woman at risk of infection, which is why she's then urged to go for a procedure, or either it's surgical or medical, to evacuate the contents of the uterus, which is a very scientific way to put it, but essentially to save her from infection and from dying, and so that she can become a mother again if she so chooses. And there's a lot of different kinds of things we do see in our medical practices. We do see plenty of women who, they're unfortunately, from the lack of a better word, but unfortunately a lot of pregnancies are influenced with exposure of the fetus to drugs, alcohol, and such. And so bringing children like that into the world where they're already not healthy, in that case, that's definitely would be a more individual case-by-case basis, for each family to consider. So I would just wanted to contribute that medical point of view, and urge that be considered before a law is passed to just, allow for everyone to give birth no matter what.
Thank you, Doctor. Representative Bagley?
Thank you, Mr. Acting Chairman. I'd like to invoke the 3-minute rule, please.
3-minute rule. Representative Bagley has made a motion to invoke the 3-minute rule. Members, remember this would be for throughout the day. So if we do it, it's going to be for every bill. Have any objection? No objections. We've enacted the 3-minute rule. Representative Cox?
You're on the end. Your name is Amy?
Amy Irvin.
Yeah, Amy. Thank you, Miss Amy. I would just want to let you know in that event, I said I'm from the rural area. I believe in equal pay. I believe in women's rights to live. I believe in health care, one of the components of it. I said I carry a bill for children. I have great respect of women. I was raised by women. So, having said that, some of the things you said, you put me in that box. And you rightly so have a right to say that. But sometimes you may want to think about what you say. The other problem is that we have in this state where if you have a child, there's an option for abortion. Not abortion, yeah, then that's not an option, which we shouldn't have, but adoption. The word seems almost similar. You can take it to a fire station. You can take it to a police station. You can leave it at the hospital. But I grew up, and my mother is black. So all these categories you talk about what we as legislators don't believe in or what we're saying. Let me make this perfectly clear. My mother could have given me up, single parent. I'm at fear that we will, with the rate of abortion across this country, that who's that kid that's going to be able to solve cancer? Who's that kid that's going to be able to do all the things, or who's going to fill the gap where I was and the things and stuff that I've done if my mother would have had the right for abortion? I fear that. So I say this, that we're making every effort to do what is right. And if someone gets an infection, that's why we passed affordable health care. So, I just wanted to say that because you boxed everybody into the same category, and I think not many of us here even fit those things you said. I don't even know one. So sometimes when you say things, now I do believe that a woman is going to die because she has to choose between her life and the child, then that's a different story. I just wanted to go on record to say that, Mr. Chairman. Thank you.
You're definitely on record. Representative Moore?
Thank you, Mr. Vice President. I just wanted to make mention to you all and to the others in this room. I don't normally talk about this, and I limit my conversation. But 61 years ago, at the age of 14, my mother became pregnant. She was a housekeeper. When she told the father that she was pregnant, he offered an abortion. But I'm here 61 years ago. And 32 years ago, with my last child, I was told to have an abortion because there was going to be some birth defects. And they went through the process of telling my husband and I what my child was going to look like. But she is 32 and healthy, and the information they'd given me was incorrect. But if they offered me to have that abortion, and we declined. But if I'd had that abortion and found out later that the information was incorrect, I don't know what my life would have been like. But I just wanted to share that information with you, that my mother and myself. But I don't bring that into these types of decisions. My job is, as an elected official, state representative, is to make just laws to the best of my ability. And I do take everything that I hear in consideration. So thank you for being here and sharing your information with us today.
Thank you, Representative Moore. I want to thank you for your story. I think that stories are very important for people to hear, including abortion stories. We oftentimes would like and appreciate people to come to these committee hearings to share their personal stories. That is those are the stories that are missing from this conversation. The women who have chosen abortion for many reasons, including, fetal anomalies, because of rape or incest, because they experience health conditions that prevent them from carrying a pregnancy to term, because it's not the right time in their life to carry or to carry a pregnancy or become a parent. We support all decisions. We support a woman in her decision about if, when, and how she'd like to be a parent, whether she'd like to be a parent or not to be a parent. We happen to provide financial assistance to people seeking abortion care because there are bans on state and federal insurance. And as I said, many women do choose abortion for many reasons that are often discussed in this committee hearing or aren't even acknowledged.
Thank you for your comments.
You finished, Representative Moore?
Yes. Thank you.
All right, there are no more questions. Red cards as present do not wish to speak and in opposition. Britton Forsythe, Joseph Carvso. Man, next time y'all print these, please. Maybe I just can't read. I don't know. Katie Donahue with Reproductive Justice Action. Dr. Laura Bertolone. D.W. Hunt with Planned Parenthood, Patrick O'Flaherty, James Fabazak, Aman Malik, Bailey Goodwin, Brandy Melissa, Ain with Steer, Executive Director of National Association of Social Workers, Eli Schilling. That's it for the red cards. Present and will provide information if requested is Chantel Taylor. Also, green cards that just came in, present but would not like to speak in support of the bill, Nicole Lanford, Sarah Lanford, Connie Lanford, Rachel Lanford, and Orma Lanford. I see no further questions. Senator Milkovich, would you like to close on your bill?
Thank you so much. And I'm going to work to abide by Representative Bagley's 3-minute rule. I thank you, Mr. Acting Chair and Chair and members of the committee. We have heard about family planning and health care and public health, but I would very respectfully suggest to you that terminating the life of unborn babies, that's not really, I think, what we as Louisianans consider family planning or health care or public health. I appreciate the point, Mr. Acting Chair, that you brought about, do we invest in children after the war? Absolutely. And by the way, I did vote for raising the minimum wage, and one of them, the most recent version that it was in as a statewide in 2018, I voted for equal pay in the earlier form. I did not vote for it the most recent because it was kind of a complex legal thing where they shifted the burden onto the defendant. But when it was a straight equal pay, I voted for that. I supported university health. I had the privilege to spend a great deal of time protecting our public-private safety net hospital in Shreveport. And by the way, that doesn't make me extraordinary. Where I'm come from, that's what you call an ordinary citizen. And I've had the privilege over time to spend time with kids that don't have parents. There's nothing extraordinary about that. Where I come from, as I'm sure you can appreciate, Acting Chairman Miller, that's the way people in Northwest Louisiana, really that's the way people in Louisiana live. If kids don't have parents, we step up to the plate. We don't always look to the government, but we're coaches, we're Sunday school teachers, we mentors, we take the Bible to hospitals and juvenile detention centers, and that's our great joy. So the one point that I will agree with, and I think it's the only point that I agree with with the opponents, is that yes, after a child is born, God really calls every single one of us to sacrifice to help the children. And I appreciate the sacrifices that you're making to serve on this committee, and I thank you in advance for doing what you will do to protect our next generation. Thank you very much.
He's closed. Already, Representative Bagley?
Already, I would like to move this bill forward.
That's already done by Representative Cox.
Thank you, Representative Bagley, and thank you very much, Colonel Cox.
Senate Bill 184 is reported by Representative Bagley favorably. Is there any objections? Representative Cox, what did I say? Oh, Representative Cox have reported favorably. I see no objections. Hearing no objections, Senate Bill 184 is reported favorably.
Thank you, Mr. Acting Chairman. Thank you very much, members, for your courtesy, and thank you, Colonel Cox and Representative Bagley.